For the pharmaceutical industry, electronic health record systems represent a new set of tools their customers in practices are using. They're using the EHR systems to guide the workflow, to suggest and guide their treatment decisions, to write prescriptions, and to educate patients.
Virtually all prescriptions today are written using an EHR, and as a result, pharmaceutical companies who are interested in engaging with physicians at the point where they're prescribing really need to understand how physicians are using the technology in their offices.
I think EHRs can help physicians collaborate with the whole care team. Everyone does want to work together, right? Everyone's passionate about providing, helping the patient get healthier. And it's just a question of, how can the technology get out of the way and let that happen?
So one of the best ways that a pharmaceutical company could leverage the power of the EHR is to encourage the use of a single patient list to identify a gap in care. If you have a patient who meets a certain set of criteria, let's say a lab value or a vital sign, or perhaps a medication therapy, but yet they're not really responding as they should be, then there's an opportunity to intercede based on the analytics. And the cool part about the EHR is that logic can be built in. So the physician doesn't need to do the calculations in their head or try to remember by writing a note. The computer will remind them.
Sales representatives have good relationships with practices, and those practices will take cues to create favorites, to use patient education in the workflow, to increase the screening that a practice may be doing for a particular disease state. The representatives with excellent relationships in those practices will find that the practices will rely on them for the ideas and the concepts around how to improve quality using their EHR.
Life science companies know their products, they know the therapeutic areas, they're experts, and they would really be a great partner to work with hospital systems, payers, large healthcare stakeholders to have a role in making population health work.
So EHRs have those tools built in. Getting them activated and configured properly represents a great opportunity for the pharmaceutical industry to assist. They have tons of great patient education information, both on the condition as well as on the drugs themselves. And that can be used to help educate and engage patients, increase adherence, and motivate the patients to stay on therapy for even longer periods.